Understanding the common cold rhinovirus. Rhinoviruses are the usual suspects when it comes to the common cold. They are tiny germs that spread easily from person to person. These viruses are highly contagious, which is why colds are so prevalent. Rhinoviruses primarily target the upper respiratory tract, leading to those familiar cold symptoms. The severity of a rhinovirus infection can vary widely. Some people experience mild sniffles, while others battle more intense cold symptoms. Rhinoviruses spread through tiny droplets released into the air when an infected person coughs or sneezes. You can also contract the virus by touching contaminated surfaces and then touching your eyes, nose, or mouth. Interestingly, there are many different types of rhinoviruses, making it challenging for our bodies to develop complete immunity. This explains why we can catch colds repeatedly, even if we've had them before. Recognizing the symptoms of a rhinovirus infection. Rhinovirus infections typically announce themselves with a set of telltale symptoms. A runny nose, often with clear mucus, is one of the earliest signs. Nasal congestion, making it difficult to breathe through the nose, commonly follows. Sneezing is the body's way of expelling irritants, including viruses like rhinoviruses. A persistent cough, either dry or producing phlegm, can also accompany a rhinovirus infection. A sore throat is another frequent complaint, often described as scratchy or itchy. Headaches, ranging from mild to moderate, can add to the discomfort. Fatigue, a general feeling of tiredness and weakness, is a common symptom, particularly in the initial days of the infection. Some individuals may experience a loss of appetite. In some cases, a low-grade fever may develop. Diagnosing rhinovirus, tests and procedures. Diagnosing a rhinovirus infection typically involves a combination of a physical examination and a review of the patient's medical history. Doctors will ask about symptoms, how long they've been present, and if the patient has been in contact with anyone else experiencing similar symptoms. In most cases, the characteristic symptoms of a cold are enough to make a clinical diagnosis. However, in certain situations, further tests might be necessary to confirm the diagnosis or rule out other conditions. Rapid antigen detection tests, often available in a doctor's office, can quickly identify the presence of rhinovirus antigens in a nasal swab. Polymerase chain reaction (PCR) tests are highly sensitive and can detect even tiny amounts of rhinovirus genetic material in a sample. Serology tests, which analyze blood samples for antibodies against the virus, are less common for diagnosing acute infections but can be helpful in research settings. Treatment and management of rhinovirus infections. Unfortunately, there is no cure for the common cold. Antibiotics are ineffective against viruses like rhinovirus. Instead, treatment focuses on relieving the uncomfortable symptoms and supporting the body's natural healing process. Rest is crucial, as it allows the body to direct its energy toward fighting off the infection. Staying adequately hydrated by drinking plenty of fluids such as water, broth, or herbal teas is essential to help thin mucus and prevent dehydration. Over-the-counter medications such as decongestants, pain relievers, and cough suppressants can provide relief from specific symptoms. Gargling with warm salt water can soothe a sore throat. Using a humidifier or taking a hot shower can help to loosen congestion. It's important to note that antiviral medications are generally not recommended for uncomplicated rhinovirus infections. However, in severe cases or for individuals with weakened immune systems, a doctor might prescribe antiviral drugs. If a secondary bacterial infection develops, antibiotics might be necessary.